All right, go ahead.
I can't see the slides.
Can you see it now?
No. Are they showing up? Do you want me to just look at mine?
Yeah, it's showing up on the screen right now. Skylar, do you want to try advancing again?
Yeah.
Yeah, okay. Yeah, just go ahead and pull yours up, Naomi, and tell Skylar when to advance. I don't know what's going on.
Okay. So our group did the accreditation of healthcare organizations. And accreditation is established by a professional organization, and they assess the healthcare's level of proficiency, the organization based on a set of criteria and standards. And the institutions that can apply for accreditation are hospitals, nursing homes, office-based surgery practices, home care providers, and laboratories. And the reasons why these organizations would want to be accredited is to reduce medical error, maintain quality healthcare, and assure medical ethics. I guess next slide. What is accreditation? Accreditation of medical services began in 1969 with the accreditation of behavioral health facilities, and the programs that have been created since then are for ambulatory services, hospitals, home care, and labs.
So we were asked the question, is accreditation mandatory or voluntary? In the textbook it says accreditation is not required to have and is completely voluntary. It began with the efforts from the AHA, the American Hospital Association, and the ACS, American College of Surgeons, to improve the quality of care delivered. Although not mandatory to have, the Joint Commission accredits nearly 80% of all eligible healthcare organizations. It is considered a gold standard for accreditation in the industry. But if you want to participate in Medicare, accreditation is required for certain programs and services.
All right. So we're talking here about the impact of accreditation versus the board of certification. And for accreditation, I used, for example, Joint Commission. Joint Commission and many other accreditation associations, I guess you would call them. They help organize and strengthen patient safety efforts, strengthen community confidence, provide a competitive edge, improve risk management and reduction, reduces liability insurance costs, provides education to improve operations, provides professional advice and counsel, enhances staff recruitment / development, and provides Medicare certification. And then compared to board certification, the impact it has is it indicates a physician's mastery of their field of expertise and provides peace of mind to patients. And it helps employers notice the adequate specialization or the skills of the physicians, and encourages further medical education and skills, and it brings personal satisfaction. And I can't read that last one, but yeah.
It says more marketable.
Okay, yeah. So it makes physicians more marketable, and so it makes it them more eligible, or not more eligible, well, yeah, that too, but more attractive to employers. Okay, next slide. Okay, so this is the process of accreditation versus the board certification process. And so, and in this example, I used the National Committee of Qualified Assurance for accreditation because I didn't want to overstep my boundaries with Joint Commission. But so there's two different processes. There's the off-site evaluation, which in this case they fill out. They basically fill out an application, and then they also go through a plan of self-evaluation and the materials that they submitted to the National Committee of Quality Assurance, and they do that through interactive survey system. And so after that so then this committee reviews what they've submitted, and then there's the on-site evaluation, and that lasts for 2 days, and during that review they go through different records that they have there, and then also the records that they submitted. And then the board certification, I did it for the I believe it was the American Board of Physician Specialties. I think that's what I did before, I just didn't say it. And so the requirements for that, or these are just basic requirements, but they complete an advanced in specialty training of 3 to 5 years, and then processes a full unrestricted medical license, or possesses, sorry. So they have to have a medical license, and it needs to be up to date, or legal for them to practice in that state, and then willing to become certified after 8 years. They have a limit to 10 years, but they want people to make sure that they renew it sooner than the 10 years to keep up with it, with their certification, and then completes at least 50 hours of continuing medical education annually, and completes, spelled that wrong, a remedial medical ethics course for recertification, and adheres to the Code of Ethics by the American Board of Physician Specialties. And then again, I can't read the bottom, so
no, it says requires successful completion of a written examination.
Okay, yeah. So then so they have to pass an exam basically. So in order to receive that certificate.
Alrighty, next slide. Okay, so the question that I answered is, what is the role of the ISO in this process of accreditation? So I'm just going to talk a little bit about what is the International Organization of Standards and its role, obviously. So the ISO is an organization that sets standards for international services. They pride themselves in quality control from health and food safety to managing global water resources even. Their standards influence and maintain the quality of health in many ways, including promoting global harmonization of medical practices, protecting the health and safety of patients and healthcare providers, supporting efficient exchange of information and protection of data, and improving the quality of care. The next slide. So more than 1,300 of the ISO's 21,000 standards are related to the health system. The Senate accreditors assess a healthcare's organization level of see based on a set of standards and criteria. The ISO's role is to help uphold and improve on those set standards that they have in line.
All right. Is that it?
Yeah, and those are the resources.
Awesome. Great job, guys. Accreditation is a big part of a big thing in healthcare administration within the healthcare industry. Let me pull this up real quick. So yes, I mean it's a big deal. Really important. As you'll learn a lot of different organizations like the Joint Commission and ISO. They have things which are called deemed status, which I believe you'll learn about this week. It said last week you were going to learn about deemed status, but it's this week. Essentially, deemed status is just saying that Medicaid or CMS is saying that if you're accredited by this governing body, then you're good enough for us. You can receive Medicare or Medicaid reimbursement. You can have these different things. So while it is voluntary, it's a really good thing to do. It's something that drives people in health systems crazy because they kind of have an itch because they're always wondering when's the accrediting body going to come in and do a survey on us, and so it's a big deal. They have the whole departments that are dedicated to that. I mean, in and around healthcare, we have internal surveys that come around. It's exactly what the Joint Commission or ISO would do, and they do those internal surveys to make sure that we're on par, ready to go if we were to have a survey come. So it's a big deal. But you guys did a great job. I have a question just for all of you, really quick. So I'll start with Colton and work across the board. So Colton, it's the same questions for everybody. As you were studying about accrediting bodies and accreditation in healthcare, what was one thing that surprised you or that you didn't know before that you'd like to share with the class?
What surprised me was, I think more than anything, was when I was doing the research and going through different websites for these different organizations and accreditation organizations. I found that how much they benefit and how much they are necessary in healthcare administration and for, I guess, the organization of the hospital or whatever it may be. Like it's not necessarily something that's always I guess essential, but it basically is, because if they don't have it, then they miss out on so many benefits. And so that's something that really stuck out to me a lot.
No, I agree. I mean, do you want to go to not meeting a certain set of standards? I mean, I don't think I do. So.
Of course not.
Thank you, Naomi. Same question.
It was all new to me. I thought it was really awesome that there's programs out there that I guess like evaluate these organizations to make sure that they're doing like good quality work and progressing. And so I think that's great because they're making sure, like, checks and balances, making sure that they're doing their best work, you know, and there's a way for an independent source to push that.
Great. Eric. Colton, can you ask me? Go ahead.
The thing that I found most interesting, I just thought that it was kind of cool that the ISO had so much presentation under it. It has 9,001 on that last slide that we had. and they have a series of standards, and it goes through, like I said, the 21,000 of those standards, and I think that it, kind of like Naomi said, that it's hate that they have so many rules and things that keep us protected and keep everything running smoothly.
Great, thank you. Skylar.
Yeah, this was pretty new for me too. But I thought about, like at my work right now, we have a President's Award, and they give that out yearly, and we've had it for like the past 15 years in a row. But it's an award given to us if we're improving our work, taking care of customers, and making sure that they receive the best service possible for this particular brand of vehicle that we sell. And it was good to read about this because it let me know that that you don't just become a doctor and go work at a facility and you just kind of practice the way that you need to, but that there are programs in place that help your facility and help your patients receive the best quality care that they can. So for me, that was pretty cool to learn about.
Great. All right, guys, I'm going to stop recording now, but hang on the line for just a second here.